policies, it has a demand on the healthcare waste program that we must develop quickly to match this. So we were very proactive in this arrangement. So we started the healthcare waste program as far back as about 7 years ago, because we projected that Lagos growing to be a mega city. Mega city means mega problem, mega challenges, and the healthcare waste demand is another mega problem, mega challenge that will come. So we started putting structures in place to really match this, and that's exactly where we are right now in Lagos. We succeeded in pushing through the national healthcare waste policy. So we now have a policy, a national policy on healthcare waste, and this will be followed quickly by a promulgation of the appropriate laws to guide everybody in the nation. So we're not looking at Lagos in itself, because if we're only developing Lagos when it comes to healthcare issues, then we're only looking for trouble. We need to spread it around other states in Nigeria so that we can have standards that will run through everybody. So in Lagos, we started early, and we were rolling very well, matching the waste that is generated every day from our primary healthcare institutions, the secondary general hospitals, and the tertiary healthcare institutions that are around in Lagos. And the healthcare product are becoming sophisticated each day, from blood, tissues, sharps, and pathologicals to hospitality waste, and it goes beyond those two. Actually, we have even the cosmetic services, talking about pedicures, manicures, even barbing, the haircuts, and you have blade from haircuts. So all this thing, the dragnet is becoming wider, and we're giving this kind of waste special attention it requires, so that we don't spread diseases among our people.
We have about 26 PSP operators handling medical waste alone. We move around hospitals, laboratories, maternity homes to pick waste and bring to the treatment plants here. They collect this waste in a designated van, white van, white van, marked medical waste with the biohazard sign. You must have been seeing them around Lagos. We have them allocated to each local government, but some efficient ones among them handles 2 local governments. Those that have proven that they are effective and efficient, they handle 2 local governments. Then we have other categories of PSP operator that handles medical waste from primary health centers only. We have about 8 of those ones. So altogether, we have about 26 PSP operator handling medical waste alone, apart from the other over 350 waste operators handling domestic waste in different wards of Lagos State.
We have 3 categories of waste. We have the general waste, that is the office waste, that is the paper and all the stationaries, that goes into the black. Then we have the infectious one that goes into the yellow bag, and that is the base. That's where the waste are being segregated from the lab, from the theaters, and everywhere where the medical waste are being generated. They are being segregated, put into different section of the color of their bags from that very unit where it's generated. From that unit, all our doctors and medical practitioners in-house and consultants know all this, and we segregate them from that unit. And we also have different boxes outside here where you've seen the agency taking care of, authority, the Loma agency taking care of it from this unit to pick it up. We also have different cabin for them to keep them in, and when they come, they always know, they've seen the colors of the bin, the yellow, the black, to pick up accordingly in that category.
Presently, we still have challenges of electricity supply, and so it has to be driven on power. Now we have said, let us bring it to a place where we can do it 24/7 using the facility of government. That is where we are. Some people are generating quite a lot that they need to do at the facility level. But because of the other challenges, why don't you let the waste managers help you to manage your headache, which is the waste? And that is why we felt we should have a central place. And that is what we have in Oshodi. We have the first equipment that is handling the healthcare waste management in the whole of Africa today. The only person that have it is the people in Egypt, but we are the only one in West Africa, in Nigeria.
So the waste is transported to us, to Loma, at the treatment site. We have adopted, the state government has adopted the hydroclave machine, the Ecodas T1000 machine. It's just one of the automated equipment for treating medical waste. And it is adopted here and some other countries because it is environment friendly. It does not release ozone depleting substances. Then it reduces the waste to about 80%. So it's equally sterilized, shred the waste, sterilizes it, and make it possible to dispose along with other domestic waste. It is just one of the automated equipment approved worldwide. The world is facing out incineration because of other materials that is being released after treating the waste. It's an automated equipment that utilizes steam sterilization. Like I said, it shreds the waste, sterilizes it, rendering it possible to be disposed of like any other domestic waste, along with other domestic waste. When the waste comes in, it is taken automatically through the conveyor into the treatment vessel. It's a cylindrical machine. Inside the machine, you have the shredder that will shred the waste. Then the heat for the sterilization is through the steam being built up by the boiler. The equipment comes with 2 units of boiler to generate the steam. Once the waste is being deposited into the vessel, it is enclosed. The whole process is enclosed. So from loading to the end point of loading. From loading, you move on to shredding, heating. Then the waste, the shredded waste will stand for a particular time at a particular temperature to make the treatment very efficient. So after standing, the waste needs to be cooled down. The temperature must be dropped before it is being discharged. To cool down for some time, then we offload it. So what comes out is a sterilized waste that can be disposed of along with the other. So the whole cycle takes 60 minutes. Let me add that when the waste comes in, we weigh it. We want to know the quantity of waste that comes in because data is very important to us and to the state as well. This so-called medical waste is just about 15 to 25% of the total waste we are expecting from the healthcare facility. So we are keeping this record just to track the waste. Once we notice that, the waste coming from a particular facility is outrageous, we'll call their attention. Are you doing the proper thing? Probably you are not putting the right thing in the material. In some cases, we do find bottle, can, which are not supposed to be in this color-coded bag. Those ones will weigh so much. So we'll call the attention of the facility that we are not doing the proper thing.
There are gaps and challenges in some units regarding the availability of loose disposable injection equipment separately for sharp and non-sharp infectious healthcare wastes. Regular running water and soap for cleansing hands, and non-adherence to universal precaution that will reduce the likelihood of contamination of injection materials by few staff members. Moreover, there are units that do not provide support and counseling service for staff reporting sharp injuries and poor utilization of hepatitis B vaccine among service providers. Hence, there is a need for investment in sustained continuing medical education and in making available logistics and support services to ensure that health workers adhere to standard guidelines and practices. Continuing medical education could be used to strengthen both technical and institutional capacity, since it will reinforce injection safety practices by health workers, while at the same time enhance commitment and oversight functions of the unit supervisors to ensure availability of needed materials and compliance with standard guidelines and practices.
We expect that facility, they must care for their waste as well. But this waste that we are talking of, they are not to be handled anyhow. They are infectious waste. They have their own effects if it is not being managed properly.
The first thing is you have to be registered. If you're a hair care institution in Lagos, you must be registered by a farmer, and a farmer is the Hair Care Facility Management Authority in Lagos. And one of the criteria for registration, for registering you as an hospital hair care institution, is to have a LOMA registration also. That you are registered with LOMA for collection of your hair care waste products. And once you're accredited along that direction, we put you on our dragnet and we allocate a private waste collector to you who comes to pick up your waste on a regular basis. And from there, we track the waste from our own accredited vendors, and the waste are taken to, after collection, they're taken to our waste treatment facility at Oshodi, where we now process this waste on our machines, and we process them, they become in-earth. And from there, they get to our landfill because they're no more dangerous. So we take them to our landfill sites, and they are stable out there.
That is our program today. Thank you for watching. But you can reach us anywhere and anytime by writing to earthfile@channelstv.com. I am Ayola Kasim, inviting you to join us next time for another edition of Earthfile. From all of us here, do have a nice day.